Hello, and welcome to another episode of the Medical Moment. This is part 2 of a series we're doing on cancer. Prostate cancer we've done, and now we're going to talk about breast cancer. Breast cancer is one of the most common cancers that affect women in America. In fact, 13% of women will get breast cancer, and that's a lot. We're predicting in the year 2022, and in fact, that adds up to over 287,000 women. So we're here today to try to break up this cycle and see can we get breast cancer going down, increase our survivors. But the first thing I want to talk to you about is a lot of times people don't understand cancer. They say, well, what is it and what does it really do? And I'm going to try to break this down real simple to tell you what's the difference between a normal cell, a benign cell, and a cancerous cell. Well, the human body is made up of thousands and thousands and thousands and thousands of cells. That's what make up the tissues in our brains, and all our organs and all get started with the cell. And in the middle of the cell is our nucleus. And I used to always like to think of the nucleus like the control center for the whole cell. Like the brain controls the body, it kind of directs signals everywhere and tell them what to go and what to do. Well, in cancer, cells usually grow normally, and then they drop off, and then the body produces a new set of cells, and they do their job and get old and they die. So everything is done in an orderly fashion. You always want things done in order. Even the Bible said, be decent and in order. So you got to be in order. Well, in cancer cells, for some reason, that nucleus, which is in the center of the cell, goes a little renegade, and these cells start producing on their own, almost like a lot of people take over on their own. And not only do they start growing on their own, they don't know when to stop. They just keep growing and growing and growing and growing, and they produce after themselves. So in other words, they're producing cells just like themselves, on and on and on and on. And next thing you know, you've got a tumor. And so a tumor in cancer can either be malignant or it can be benign. In breast cancer, the tumor is malignant, meaning it can spread, and one of the first places it like to spread to is the lymph node. So any lady out there who've had problems with breast cancer, you know the first thing the doctor want to talk to you about, they want to do this thing called staging. They want to stage where is this cancer and has it spread outside of the breast, and heaven forbid has it gotten in the lymph nodes. So just remember, these cells are out of control, just like a lot of people out there are out of control. They're just growing on their own. They do not stop, and they produce after themselves. So that's the problem that we have with cancer. So who's at risk for breast cancer in this country? And why is breast cancer in women remain our number one cancers we have affecting women, and that we're predicting so many in the future? Well, number one is you're just female, just being a female. 1 in 8 women probably will get breast cancer, and that's 13%. And that's, like I said, over 287,000 women. They predicting right now will get breast cancer this year. And then men, and a lot of you men don't know this, so don't turn away and go, oh, I don't have to watch that because I won't get breast cancer because I'm a man. No, did you know that 1% of men get breast cancer? In fact, a very dear friend of mine died with breast cancer, and it was horrific because you just never think of men and breast cancer. And we're predicting over 2,700 men will be diagnosed with breast cancer this year. So men, you have got to get physicals and pay attention to your breast health too. And any little lump or anything unusual you feel in your breast, don't think this is just a thing about ladies. You need to get yourself checked out also. So what are the risks for getting breast cancer? Who is at risk? Number 1, woman. Number 2, men. So women, men, you at risk. The other thing is just advanced age, just getting older. And a lot of cancers, just they're age related. As we go older, your risk for getting a certain cancer is more and more and more. So advanced age. If you have a personal history of breast cancer, a lot of times when a patient has a history of breast cancer, the first thing they'll think is, oh, well, I can't get it again, or it can't get another breast. Oh, yes, it can. It can reoccur, and it can reoccur in that other breast also. So if you have a personal history of breast cancer, you want to stay with your primary care doctor, and you want to keep up with your visits to your oncologist so we can keep a close watch on this thing. The other thing is a family history of breast cancer. If mama, sister, daughter, we call these first line relatives, grandmothers, real close, has a history of breast cancer, please tell your doctor about it. And parents, do tell the daughters and all if you have a history of breast cancer, because this can also make it run in your family. So everybody needs to know who's had breast cancer. Sometimes have a health party with the family and everybody kind of share what's going on with it and write it down. So when you go back and talk to your doctor, you can actually tell your doctor, these are some of the things that has been going on with me, and these are some of the things in my family that we need to address. And the other thing is giving birth after the age of 35, when you get older and have, because you've had all this unsuppressed hormones hitting those breasts all those years, you at extra risk of having breast cancer. If you started your menses early in life, or you started the menopause late in life, again, all those unopposed hormones going on, so that puts you at risk for breast cancer. Obesity. You need to lose a little weight. Try to always get down to that ideal body weight. Alcohol. We can associate alcohol and cigarettes and obesity with everything we're going to talk about on these shows. So if you're doing any of those things and doing them in excess, you need to quit. If you're smoking, you need to quit. Number one cause of preventable death is smoking. You need to quit. Ladies, cut down on the alcohol. Y'all goozling pretty good out there, ladies. I don't know what happened to you, but you all are really out drinking the men in most cases, especially these happy hours that y'all going to. And you're not leaving very happy because you're leaving a little bit drunk, where you need a designated driver. So come on, ladies, let's kind of back off and go home and eat some salad. And then the other thing is, if you've been exposed to radiation exposure years ago or previously or right now, hormones can sometimes trigger this thing. But then there's one in particular I want to talk about. I won't spend a lot of time on this, but y'all remember the actress, I love her, Angelina Jolie. The BRCA1 and BRCA2, these are genetic types of conditions that you can inherit. And remember, she had to have a double mastectomy, and you can have problems with your uterus and your female system, and she had all that done too, because those are associated with breast cancer. If you think that those genes can be present, make sure you talk to your doctor about BRCA1 and BCRA2, and they actually can affect men also. So men, again, you're not spared. So what are we going to do? The biggest thing still is early detection. Prevention is first, but then we always come back to early detection. Go to your doctor, make sure you keep up with your physical, check your breast, don't mind just running your finger over your breast to see if you feel something like, oh, I felt this last month. I didn't feel this little lump this month. So go and let your doctor take it out. Your doctor's a wealth of information for you. They will always help you. So make sure you go back to your doctor and tell them, I feel a lump. I need you to check it out. There are things they can do. They can do a routine, a diagnostic mammogram, just depending on what they find. They can do ultrasound, they can do a biopsy if you need it, just whatever you need. Your doctor is equipped to make those recommendations to you, and up to you to follow them. But on the best part about it, and we can always go back to, let's always do early detection. That's the key to healthcare. And we can catch stuff early. We can do all kind of things. I don't need you to come in and the symptoms have been going on for years and years and years, and you just telling me about it. Prevention is always good. My grandmother said, ounce of prevention worth a pound of cure. I'm the one changed it to the pound. So I can change it if I want to, fair. And you want to do those things we talked about. Exercise, decrease on that alcohol, stop smoking. Ask your doctor ways to stop smoking, and at least when you exercise, do 20 to 30 minutes, brisk walk every day. Try to eat lots of fruits and vegetables. They're good for you. Keep stress out of your life, and please, please, please try to keep that positive attitude. We find out laughter and a positive attitude goes a long way in our health care. So those are the risks of breast cancer. It's in your family. Just let the doctor know. If you feel anything in your breast, let your doctor know. We want to keep you here forever. This has been Dr. Valerie Walker, and that was just a medical moment keeping you up to date on breast cancer.